Congratulations on this exciting yet sometimes challenging phase of your baby's development. Teething is a natural process where your baby's first teeth emerge through their gums. It's a significant milestone marking their growth and development. While it's a natural part of life, it can be uncomfortable for your little one. Most babies start teething around 6 months old. However, don't worry if your baby starts earlier or later. Every child develops at their own pace. Some babies may even get their first tooth as early as 3 months or as late as 12 months. Rest assured, this is perfectly normal. Remember, teething timelines vary significantly. Your baby's individual journey is unique. If you have any concerns about your baby's teething progress, don't hesitate to consult your pediatrician for personalized guidance and reassurance. As your baby grows, their teeth will continue to emerge gradually. By the time they're 3 years old, they'll likely have a full set of 20 primary teeth, ready for all the adventures of childhood. Teething can manifest in various ways, and every baby experiences it differently. Some common signs that your baby might be teething include excessive drooling, swollen and tender gums, and a slight increase in temperature. These symptoms are usually mild and temporary. You might notice your baby chewing on their fingers or toys more frequently. This is their way of trying to relieve the pressure and discomfort in their gums. Additionally, your usually cheerful baby might become a bit fussier than usual, especially during nighttime feedings. Some babies may experience disrupted sleep patterns due to teething discomfort. They might wake up more frequently or have trouble settling back to sleep. While this can be tiring for both you and your baby, remember that it's a temporary phase. If you observe any of these signs, it's highly likely that your baby is teething. However, it's always a good idea to rule out other possibilities. If you're unsure or if your baby's symptoms seem severe, consult your doctor to ensure there's no other underlying cause. There are several ways to ease your baby's teething discomfort. Apply gentle pressure to their gums. Massage with a clean finger or offer a cold, wet washcloth. Teething toys provide relief. Choose firm rubber toys filled with water. Chill them in the refrigerator. Always supervise your baby. Maintain good oral hygiene. Wipe their gums after feedings and before bedtime. Extra love and attention can comfort your baby. Hold them close, sing, or spend quality time together. Section 4. Safe and effective pain relief options. Consider using over-the-counter pain relievers like Tylenol or Advil for teething pain. Always follow dosage instructions and consult your pediatrician. Avoid teething gels with benzocaine or lidocaine. Homeopathic tablets and amber necklaces are not proven effective. Use medication cautiously and as a last resort. Contact your healthcare provider with any concerns. Prioritize your baby's safety and well-being. Section 5. A passing phase. Remember, you're doing great. Teething, while sometimes challenging, is a temporary phase. Your baby's teeth will eventually emerge and the discomfort will subside. In the meantime, remember to be patient and compassionate with both your baby and yourself. You're doing an amazing job caring for your little one. Every cuddle, every soothing touch, and every moment of comfort you provide makes a difference. Don't hesitate to seek support from your partner, family, or friends if you need a helping hand or simply a listening ear. Celebrate these milestones, even the ones that come with a few tears. Your baby's first teeth are a sign of their growth and development, paving the way for a lifetime of smiles and delicious meals. As your baby grows and develops, cherish these early moments and trust your instincts. You're doing great, and you've got this. Section 6. When to seek help, trust your instincts. While teething is a normal part of development, there are instances when it's essential to seek professional medical advice. If your baby develops a high fever, over 100.4 degrees Fahrenheit or 38 degrees Celsius, experiences diarrhea or vomiting or shows signs of dehydration, contact your pediatrician immediately. If your baby's teething discomfort seems particularly severe, or if you're concerned about any unusual symptoms, don't hesitate to reach out to your healthcare provider. They can assess your baby's condition and provide appropriate guidance and reassurance. Remember, you know your baby best. Trust your instincts and seek medical attention if you feel something isn't right. Early intervention is crucial in addressing any potential complications and ensuring your baby's health and well-being. Your pediatrician is your trusted partner in your baby's healthcare journey. Don't hesitate to reach out to them with any questions or concerns you may have, no matter how small they may seem.